Welcome back to Face the Nation. We want to take a closer look at one state where the crisis is getting worse. Louisiana Governor John Bel Edwards joins us from Baton Rouge. Governor, before we start, I do want to extend our condolences on the loss of your staffer, April Dunn, who we understand died yesterday of coronavirus. Thank you for joining us.
She did, and thank you very much. And she was a very sweet lady and an important part of our team, so thank you.
I want to talk about the fate of your state. You have said that Louisiana could run out of ventilators as soon as April. That's this week. Has the Trump administration given you any assurances that your state will get what it needs?
Well, not yet, and we continue to press the case. And look, we know that ventilators are in short supply for everyone. You know, all states are having this issue to one degree or another, and obviously New Jersey, New York, and other states have been clamoring for ventilators as well. But over the past few weeks, we've put in orders with the National Stockpile, for example, through FEMA, but we've also pursued manufacturers and vendors trying to place orders for about 12,000 ventilators. I think thus far we've received 192. That is inadequate to the task, because if we stay on this present growth curve that we're on with respect to coronavirus cases, we believe that by about April the 4th or so in the New Orleans area, we will exceed our capacity for ventilators, and obviously that's not where we want to be. So we're doing everything that we can to try to find ventilators, get them to Louisiana, especially down into that New Orleans area. But it is a big challenge right now.
Has the federal government told you you're on your own to secure those ventilators?
Well, no, I'm not going to say they've told us that we're on our own. We haven't yet been approved for ventilators out of the national stockpile. I continue to press that case, and I hope that we will be cut in for a slice of what they have left there, and that we get them in the next few days. In the meantime, we're identifying every breathing machine that we can convert, modify into a ventilator. We're looking at trying to source ventilators that would typically be used in the EMT area as opposed to hospital rooms. And then we're looking to see what ventilators we can use to potentially service more than one patient at a time, depending on the acuity levels of the patient and so forth. So we're doing everything that we can. This is the biggest issue in the near term, however, is ventilator capacity, and it's the one thing that really keeps me up at night right now.
You also told CBS that you need N95 masks. Those are the masks for frontline workers. You told one of my colleagues that your state is paying 4 and 5 times the normal cost when you are able to get them. Have you told the White House that this system of states outbidding each other or trying to bid against the federal government, that it's just not working for you?
Well, yeah, we've had plenty of conversations with the White House and the Vice President leading the coronavirus task force. We've had many phone calls and telephone conferences, and our situation here in Louisiana is not like other states. I'm sorry, not unlike other states. We did receive into our warehouse about 110,000 masks yesterday. They've all been distributed. So the PPE situation does appear to be getting a little bit better. We hope that obviously continues to improve over time, but it's a challenge, and everybody is paying more for these items than we would have paid several weeks ago. It's a function of supply and demand. I do think there's some price gouging going on as well, and I'm hoping that gets investigated. And as we identify practices that we believe to be illegal price gouging, we are turning those over to the U.S. Attorney for the Middle District here in Louisiana.
Yeah, that's fighting on a lot of fronts at once, sir. Is there money that you know will be coming to you through this congressional relief package?
Yes. The $2 trillion package that Congress passed, that the President signed into law, we know is going to help with hospitals with unreimbursed expenses, the expansion of telehealth. We know that families are going to benefit, small businesses, employees.
Is it enough?
Nutrition for our schools and our food banks. Well, you know, it's a very generous package. It's the largest one in the history of our country.
Right, but is it enough for you?
There's about $1.8 billion for, well, there's $1.8 billion for the state that's going to help. And so there's going to be additional legislation coming forward, I believe, as well. But we know that this is a good start, and I appreciate everything that they have done in Congress in order to help us. And we're going to be working with our congressional delegation. If we can identify other needs that we can get help on, we're going to make sure that we continue to do that.
The first confirmed case of coronavirus in your state came about 13 days after Mardi Gras.
Yeah.
You didn't cancel it. Do you regret not doing so? I know you've said the CDC didn't issue guidelines saying to do so. Is that what you were waiting for the federal government to tell you as a state what to do?
Margaret, look back to where we were at that time. I think there were 15 cases in the country, all of which had been linked to foreign travel, either directly or indirectly. There was not one person at the state or at the federal government, not at the CDC or otherwise, who recommended canceling any event, not just Mardi Gras, but I don't think anywhere across the country. And we'll know what role Mardi Gras played in seeding this virus later. But right now, that's not our focus. We can't do anything about what happened or didn't happen yesterday. We're focused on building our capacity to deliver health care in the short term.
I understand.
And slowing the spread of this virus.
I ask you the question on guidance, though, because we know the White House is preparing to issue new guidance in the coming week. So as a governor, you know, you wish you knew a few things back then. What do you need to know now?
Well, first of all, every time the CDC comes out with updated guidance, we look at it very, very closely. And we make sure that we're talking to our federal partners, whether it's the Surgeon General, whether it's Dr. Fauci, Dr. Brett Giroir, who's over testing. I've had conversations with all of those individuals to make sure that we're doing everything that we can in Louisiana. You know, we've been about a week into our stay-at-home order. We expect that mitigation works and that we'll see that come into play in the next couple of days as we continue to report the positive cases. We need to flatten the curve because we know that we're on a trajectory right now where we're not going to be able to deliver the health care that people need when they need it, not just with respect to ventilators, but a few days after that, by the 10th or so of April, bed space. And so we need to flatten the curve, surge our medical capacity. Again, these are the same situations, challenges that are facing a number of states right now.
We understand, and we wish you good luck, sir. We'll be back in a moment. We now go to the president and CEO of the Mayo Clinic, Dr. Gianrico Farrugia. He joins us from their campus in Rochester, Minnesota. Good to have you with us, Doctor.
Thank you for having me on the show.
You may have just heard the governor of Louisiana tell us that his state is about to run out of ventilators. It's the one thing he says that keeps him up at night. And by April 10th, he doesn't expect to have enough hospital beds to accommodate the sick. Is this going to be the story across this country at hospitals?
Yes, this is a critical element of our conversation and discussion as a nation. We have to focus on saving lives. And saving lives means that we have to be very diligent about it because there is no direct end in sight. And therefore, we have to continue to learn and improve as the wave of surges happens across our country. We have to really be diligent about focusing on what we can do to prevent people from getting sick, and if they're sick, how can we prevent them from entering into an ICU? And then once they get into an ICU, how can we make sure that their stay is as brief as possible? Because if, for example, you can go from 10 days on a ventilator to 5 days on a ventilator, then you can double the number of available ventilators. And Mayo Clinic, together with many other organizations, is laser focused on doing this, focusing on testing and focusing on novel therapies to be able to really flatten and bend that curve.
One of the therapies that's gotten a lot of attention is these antibody serums. Tell me what your thoughts are on how effective that can be.
So we know that in order to really handle this crisis, we have to take many different approaches. The best antiviral still remains washing your hands, and we have to remind people of that. Then there are the antivirals themselves that attack the virus themselves. Then there are agents that are effective at blocking the molecules that the virus causes our own cells to release. And that can prevent some of the damage we're seeing in the lungs and other organs, including the kidneys. And then there are these convalescent sera or convalescent plasma, where you take plasma from a person who has had the virus and has recovered and has now an antibody response to it, and take that, and in general, you can treat 4 people from 1 person. And doing so, you can provoke a given response that allows them to recover more quickly. This is based on other diseases. It is now being tried for the coronavirus, for COVID-19, and Mayo Clinic and other institutions are working very hard, collaborating with industry to make sure that we can have adequate supply to test if this is going to make a difference. And I'm hopeful that it will.
We've also heard from epidemiologists about the hope of contact tracing, basically figuring out who you've come in contact with in order to determine how at risk you are. How would something like that work in the United States?
So every country has a different threshold on privacy of information, on data, but certainly we as a country have plenty of technology to do better at tracing. We've been collaborating, for instance, with MIT on an app called SafePaths, where you can opt in, and then within your network, you know if somebody within that network tested positive or even has symptoms. Then we're working with a company called Inference in Boston at really becoming better on predicting hotspots, because currently we're predicting hotspots very close to or even a little too late from when they start to occur. And if you have the ability to use artificial intelligence to in real time know when a test is positive, but also understand things like, okay, how many tests happened in the last 24, 48 hours, because that's really important. How many people are being admitted? You can get a much better idea of where the next hotspot is and then move resources. And in the last couple of days, we've tried that. We've done that within the state of Minnesota. And we believe that there are many of these innovations that are happening across the country that will help us improve the way we trace and the way we advise people to be able to, one, avoid getting sick, and once they get sick, to understand what we can do for their immediate contacts. And that is one of the very important ways that we can flatten that curve and at the same time inform the public, because as you know, fear is a big part of this current pandemic.
Well, based then on what you have seen so far, do you think that it is underestimated how much of this virus has already infected parts of the American Midwest?
There's been a lot of discussion about that. We have to be driven by the science, not by conjecture. I mean, we always have to be driven by the science. And to be driven by science, we need to have the right testing. And testing serology is going to be very important that way, to understand who has an antibody and therefore can be presumed to have had contact with the virus and has mounted a response to it. We at Mayo Clinic have spent a lot of time developing first a PCR test, now a serology test. There are many other institutions that are doing so. And this is where innovation and collaboration comes together, because there's no one single test that is the right test, and there are many different tests that can be used. Serology for what you stated, but also trying to bring the price down. For example, the Atomic Agency in Austria is trying to use isotopes to develop a very cheap test.
Okay.
University of Washington, UC Berkeley are using CRISPR to try a different test, as well as in New York. So what we're going to be seeing is a multitude of tests, and that multitude of tests is going to be able to give us the answer to that question.
We wish you good luck. Thank you very much, Doctor.
Well, thank you very much, and I really do want to thank every healthcare worker. Thank you.
We do too. We now go to Dr. David Heymann, a professor of epidemiology who serves as a special advisor to the World Health Organization. He joins us via FaceTime from Saverne, France. Good morning to you, Doctor.
Good morning.
The United States is the wealthiest country in the world, and we are now the epicenter of this outbreak. Does how this virus affect people here in America look any different to you than what it has done in the rest of the world?
No, this is a pretty vicious virus, and everywhere it has appeared, it's caused great numbers of people to die, and it's also spread very easily in communities. So what's happening in the U.S. has happened around the world. But what has been different is the strategies to contain the virus.
From what you're seeing, it sounds like you're suggesting the strategy to contain has not worked. I mean, the White House has said now they're just trying to mitigate it.
Well, the strategy works if it started early and if it's continued even during a time when there are many cases. The objective is to identify people who are infected, either those who are sick or those who are contacts of those people who are sick, and then to isolate those people and stop transmission, while at the same time having other measures such as physical distancing and means to keep people from getting too close together.
It sounds like what you're describing is what South Korea has done.
Well, that's right. Singapore, South Korea, and Hong Kong have all begun a strategy very early to contain the outbreak. And they've tried to contain that outbreak with minimal disruption in their daily lives. There's a very important issue in all of these countries, and that is that people clearly understand how to protect themselves and how to protect others. They've been through the SARS outbreak. They know that they can stop this outbreak, and they're working very hard to do that. So that's one of the differences. They've had SARS outbreaks before. They have learned how to not only stop transmission, but also to stock up their hospitals so they're able to take people when they do become sick.
Would it be too early to lift some of the restrictions here in the United States? As a medical professional, what is your opinion? I'm not asking about the politics.
Well, at the World Health Organization, we've been discussing with a group of people how best this outbreak can be stopped and at the same time how the lockdown procedures can be lifted. And the general consensus is that it depends on the risk assessment in the country. China has already begun to unlock its heavy industrial sector and also its small business sector, and they're watching very closely to make sure that transmission doesn't increase as a result. That's what other countries need to do as well. They need to understand where the majority of transmission is occurring, and then they need to keep those sectors locked down most while unlocking the sectors where transmission is less important, and having measures in place to stop transmission should it begin to increase again.
There was a team of British doctors who wrote this week that one of the signs of exposure to the virus is loss of taste and smell. Is that an indicator? Should Americans be looking out for that?
It certainly has been an indicator in the UK and in many other countries, and I'm sure that in the US it will be the same manifestations. So yes, loss of taste has been a characteristic in some populations, but the most reliable means of determining whether or not one is infected is a fever and a persistent dry cough.
Do you have any reason to believe that once someone is infected, that they then become immune? Or do you think this virus will hit in waves again and again?
You know, other coronaviruses don't develop long-term immunity. People can get infected with those coronaviruses that cause common colds on a regular basis. So it's very important that the immune response to this organism be studied. It's too early to say for sure. Hopefully there will be a solid immunity that develops so that vaccines can be developed that will be effective and other means of prevention will be possible.
Well, there's some talk about people developing immunity and therefore allowing them to go back into society. You're saying it's not clear yet if we can say that's a safe method. You've talked about the fact that this was transferred from the animal kingdom into humans and then now spread human to human. Will animals continue spreading this disease, or was this a one-time transmission?
As far as it is understood, this was a one-time episode where an animal in nature, or even a bat in nature, because this virus is very close to viruses in bats, infected a human. And that human then infected others. And there was some mass event in the city of Wuhan where many, many different people were infected at the same time and sent off chains of transmission among their contacts that traveled internationally and also within China.
China shut its borders to foreigners yesterday. Would you advise other countries to do the same?
It has to be a risk-based assessment to really understand whether borders need to be closed. China has closed its borders because it now has more infections coming from outside China than within China itself, at least at present. And so they've decided that they want to stop this by actually closing their borders and putting people who should come in if they're infected in quarantine.
Should the Chinese Communist Party have shared more information about this virus and done it sooner?
The government in China has shared information very freely with the World Health Organization and also with others. There are many published articles from Chinese investigators that have been put out on many different medical journals in front of the paywall so that everybody can understand what's going on. So there's been, to date, quite a free sharing of information among countries and from countries to others.
Dr. Heymann, thank you for joining us.
Thank you.
We'll be right back with some thoughts on our heroic first responders. That's it for us today. We'll see you next week. But we leave you with a look at the people around the world who aren't able to weather the crisis at home with their loved ones. They're the healthcare workers and first responders who continue to report for duty to protect us. These are the troops on the front lines of this new world war. The nurses, emergency responders, doctors, scientists, and hospital staff defending us all against an advancing and invisible enemy. In New York, Governor Cuomo's call for reinforcements was met by a surge of volunteers. 40,000 retired healthcare professionals and newly graduated students stepped up to serve in the besieged and makeshift hospitals at the new epicenter of this global outbreak. Another 6,000 mental health professionals offered help to those in distress. In Seattle, New York, and soon-to-be hotspots across this country, we've seen these acts of community and courage. Hospitals cannot provide the body armor needed, the masks, goggles, and protective gear to help the healers avoid becoming patients themselves. In scenes reminiscent of the World War II home front, many quarantined Americans put their sewing machines to good use, crafting makeshift versions of face masks. Gestures of gratitude from a public told that the most useful thing they can do is to simply stay home. In Italy and Spain, where the pandemic arrived earlier, the virus has claimed a disproportionate share of healthcare workers' lives. As one New York surgeon wrote to his colleagues this week, "The enemy is inside the wire, except that there is no place to hide. They survive because we don't give up." In recognition of that sacrifice, millions of people in cities across the world took to their balconies and doorsteps to applaud from afar their nation's caregivers. The very first warning of this mysterious virus came from a physician, Li Wenliang. His urgent message was deemed illegal activity by Chinese authorities. That selfless, defiant act, a reminder that medicine is not a job, it is a calling. In this country, we're accustomed to thinking of heroes dressed in military uniforms, not medical scrubs. But a virus cannot be stopped by borders or bullets. And that has reminded us all that we are united by our vulnerability to this microscopic but deadly enemy. It will take a particular type of valor to defeat it, one rooted in protecting the very first of those inalienable rights that Thomas Jefferson once wrote of, life itself. And on behalf of a grateful nation, we thank them all for their service.